Borderline Personality Disorder by Hope Schumacher. What is borderline personality disorder? Borderline personality disorder, or BPD, is a mental illness that severely impacts a person's ability to regulate their emotions. BPD affects a person's thoughts, emotions, and behaviors, making it difficult for them to cope in many areas of life. People with borderline personality disorder may feel unsure about themselves and their relationships, and often have trouble controlling their feelings and urges. When talking about personality, we are referring to the people's views and thoughts on how they relate to the world and others. Every person has personality traits that make them unique. One could be described as shy, or maybe outgoing, or maybe even self-assured. However, a personality disorder is deeper and more severe. It can cause problems in how a person thinks and feels, which can impact their perceptions and interactions with others. People with personality disorders may not even realize that they are thinking or acting in an unhealthy way, and may even be unwilling to change. So, how common is BPD? It has been found that most personality disorders begin in the late teen years, when one's personality further develops and is finally maturing. Because of this, almost all people diagnosed with BPD are above the age of 18, and research estimates that about 1 in 100 adults live with BPD. And it's more common for women to be diagnosed, yet men do experience it at a similar rate. BPD is frequently misdiagnosed due to the overlapping symptoms with other mental health conditions, such as bipolar disorder, PTSD, or other mood disorders. The stigma around BPD is also contributing to the misdiagnosis, as well as gender bias. What are some of the symptoms associated with BPD? Fear of abandonment is the main symptom of BPD. It is found to be very common for people with BPD to feel uncomfortable being alone. And when people with BPD feel that they're being abandoned or neglected, they tend to feel intense fear or anger. This could even include going to extreme measures so that they're not separated or rejected, even if those fears are made up. This includes frantic efforts to prevent someone from leaving them. People with BPD also quite often have a distorted or unclear self-image, and they often feel guilty or ashamed and see themselves as quote-unquote bad. They may also abruptly and dramatically change their self-image, shown by suddenly changing their goals, opinions, careers, or even friends. It has also been seen that BPD patients sabotage their own progress. For example, they may fail a test on purpose to ruin relationships or even get fired from a job. Borderline personality patients have also been noted to have temporary paranoid thoughts. They are described as dissociative episodes, paranoid thoughts, and sometimes even hallucinations. All of this is triggered by extreme stress, usually from the fear of abandonment. It has also been documented that people with BPD have extreme anger management issues, meaning that they have difficulty controlling their anger and they often become intensely angry. They may be known to express their anger with biting sarcasm, bitterness, and angry tirades. These episodes are often followed by a lot of shame and guilt. With that, impulsive and risk-taking behavior is seen often in BPD patients as well. This could include things like unsafe sex, alcohol or drug use, gambling, overeating, reckless driving, or even spending money without thinking about it. People with BPD can also find it very challenging to keep healthy personal relationships because they tend to change their views of others abruptly and dramatically. For example, they may go from idolizing someone to devaluing them quickly, and they could do the opposite as well. Because of this, their friendships, marriages, and relationships with family members are often very chaotic and unstable. So then, what are the causes of borderline personality disorder? The causes of BPD are not completely understood. However, with research, it is presumably caused by a combination of genes and life experiences. It is found that up to 70% of people with BPD have experienced sexual, emotional, or physical abuse as a child. Parental separation, poor parental attachment, inappropriate family boundaries, and parental substance use disorder are also associated with causing BPD. All of these experiences can lead to strong emotions and difficulty putting trust in other people, and can result in the symptoms of borderline personality disorder. However, it is very possible to develop BPD without these experiences, and you can also have these experiences without developing BPD. Studies have also shown that borderline personality disorder runs in families. So if you have a family history of BPD, you are more likely to develop the condition. Lastly, in people with BPD, the parts of their brain that control emotion and behavior don't communicate properly. So any type of brain changes or damage could cause having BPD. Finally, what are the treatments for BPD? The most effective treatment is a mix of support and psychological therapy. Medicine can sometimes help relieve some of the symptoms, but it is not typically a main treatment. Psychotherapy or talk therapy is typically the treatment of choice for BPD. The goal of this kind of treatment is to help you uncover the motivations and fears associated with any thoughts and behaviors. Examples of evidence-based therapies that can help include something called dialectal behavioral therapy, or DBT, which is a type of therapy that was specifically developed for people with borderline personality disorder. DBT focuses on helping to accept the reality of one's life and their behaviors, as well as helping them to learn to change their life and their thought processes. It aims to teach skills to control intense emotions, reduce self-destructive behaviors, and improve relationships. With medication, the benefits for BPD are unclear, so most healthcare providers typically don't prescribe medications as the main treatment. However, a psychiatrist may recommend medications to treat the specific symptoms or any co-occurring mental health conditions. These medications can help to treat anxiety and depression, maybe regulate mood swings, or even help control impulsive behavior. Antipsychotic drugs have also been found to help some patients with BPD. With consistent and appropriate treatment, many individuals with borderline personality disorder can experience a significant reduction in symptoms and improvement in their quality life and relationships. In closing, it is crucial to remember the core features of borderline personality disorder: the emotional dysregulation, the relationship challenges, and the impact on self-perception. However, it is equally important to emphasize that recovery is possible. With evidence-based treatments and a supportive network, individuals with borderline personality disorder can learn to manage their symptoms and build meaningful lives. So let's continue to educate ourselves and advocate for accessible and effective mental health in all aspects.